What did you say when someone said that our little girl was going to win Wimbledon in like 15, 20 years?
Not if I'm still on tour.
You're ridiculous.
Everything went great, and I put a little makeup on so I could take pictures with the baby. And I just remember getting up and I couldn't breathe. I told the nurse, I need a mask. So I put the oxygen mask on, and I started coughing.
She was undoubtedly battling for her life, and I was terrified that she might die. But I was grateful that she had the wherewithal to speak up because she knew her body.
At the edge of Central Park in Manhattan, there's a bronze statue of a doctor named James Marion Sims, whose brilliant achievement carried the fame of American surgery throughout the entire world. He's the guy who created the vaginal speculum, an instrument gynecologists use for examination. He pioneered the surgical repair for fistula, a complication from childbirth, and became known as the father of modern gynecology. But that brilliant achievement was the result of a series of excruciating experimental surgeries that he conducted on enslaved women. In a lot of ways, Sims epitomizes the story of American medicine for Black women. It's a system that's failing them to this day. From infant mortality to life expectancy, the racial disparities in healthcare are staggering. The gulf between Black and white might be widest when we look at maternal mortality, with Black women 3 to 4 times more likely to die in connection with pregnancy or birth than white women. And that divide can be traced back to doctors like Sims, who contributed to a long, largely overlooked history of institutional racism in medicine.
Trying to understand a historical problem without knowing its history is like trying to treat a patient without eliciting a thorough medical history. You're doomed to failure.
The fact is that it shows that across class, people have very similar experiences. And sometimes those experiences are about the adverse birth outcome, and sometimes those experiences about the way people get treated. Many of the parents talked about moments where racism was registered as something not quite right. Something for which there may never be a legal or a juridical standard of proof that racism took place. And it took place in small acts. It took place in denials. It took place in the forms of neglect. It took place in the form of dismissiveness. It took place in the form of pain. And really the truth is that the experiences weren't only about women who were in labor or who'd given birth. It also happened during prenatal care and postnatal care, postpartum. Another finding was what I call racial refusal, which was the refusal of some medical personnel to acknowledge that racism was part of the experience of having children prematurely. They like to reckon that particular adverse birth outcome with class, to say that people of a certain class status have a greater likelihood of having an adverse birth outcome. But to rest almost the entirety of the problem on being low income, which is in some ways a way of blaming the person, is not appropriate. You have to be willing to accept the fact that across class, people have common experiences, and that common experience is in fact and can be racism. There are small ways in which people experience racism. If a medical provider says something to, say, a Black woman like, "Oh, is there a baby's father involved?" That's in some ways drawing on this historical precedent of believing that Black women have children without a partner. And people interpret that as racist, as a form of racism. I think if we can think back to Saartjie Baartman, also known as the, quote, Hottentot Venus, whose body was put on display because of the size of her the size of her gluteus maximus and size of her labia. And so there is already a pre-existing tradition of Black bodies being viewed as different and as othered. And I just have a hard time believing that those pre-existing sort of stereotypes and tropes don't manifest themselves into the contemporary moment. So what are the things that we can do to prevent people from having premature births? What are the things we might do to prevent people from having C-sections? And that's where the role of, I think, doulas and midwives and what I call radical birth workers comes in. They are there to serve as sort of witnesses to the kinds of hospitalist interventions that exist, but they're also there to help facilitate people feeling calmer about the fact that they may need a hospitalist intervention. I think doulas stand as a witness to the kinds of experiences that people have. So sometimes even if the experience isn't positive, to know that there was someone else there is helpful. But as I said, doulas are mediators. They can be mediators. They are not going to end the racial disparity issue that we have, but they are mediators, and they provide support and they provide education. Midwives have been, especially Black midwives, have been undermined in the United States. We know that strategy began in earnest with OBGYNs, with those kinds of disciplines in the 1800s, and really more earnest as hospitals grew as a site where people were going to give birth. What I think is a good strategy to be embraced is the strategy of providing people broadly with the widest range of information that they can possibly use to make decisions. Not every birth needs to be in a hospital. We should support home births. We should reimburse midwives at a reasonable rate. Just being able to take control of some of the elements of the preparation, I think, is good.